Good afternoon, everyone. This is Nicole Pearson, and I welcome you to the Saving Limbs and Saving Lives, How to Identify a Disease That Affects Up to 42 Million Americans webinar. Today, our focus is going to be on identifying patients for PADnet testing. We will look at intake procedures, visual cues, probing questions, and data mining your EMR. If you have any questions throughout the webinar, please type them in your GotToWebinar chat window, and they will be addressed at the end of the webinar. Peripheral arterial disease is a progressive circulatory condition. It results in clogged or narrowed arteries, which leads to poor circulation in the arms, legs, brain, or kidneys. Peripheral arterial disease occurs most commonly in the lower extremities, leading to decreased blood flow in the legs and feet. Additionally, PAD does increase one's risk for heart attack or stroke. Eight to 12 million Americans suffer from peripheral arterial disease. 1/3 of smokers over the age of 50 have PAD, 1/3 of diabetics over age 50, and 1/3 of patients over 70. 75% of people that have PAD also have heart disease. There is a mortality rate of over 30% within 5 years. Now let's stop and think about this patient demographic. 50 years and older with a history of diabetes or tobacco use, and all of your patients that are over 70 years old. Without treatment and early intervention, PAD can lead to resting leg pain, non-healing ulcers, gangrene, amputation, or an increased risk for heart attack or stroke. In terms of 5-year mortality, patients with PAD have a lower survival rate than patients with breast cancer or Hodgkin's disease. In fact, cardiovascular disease accounts for more deaths than cancer, infection, and trauma combined. Who is at risk for PAD? Of your patients that are over 70 years old and patients that are 50 and older with a history of smoking, high blood pressure, or diabetes. Other risk factors for PAD include patients who experience foot or toe pain that often disturbs sleep, patients whose toes or feet are pale, discolored, or bluish, patients who have skin wounds or ulcers on the feet or toes that are slow to heal, patients who have diminished or absent pedal pulses, patients who have suffered a severe injury to the legs or feet, patients who have an infection of the legs or feet that may be gangrenous. Indications for a PADnet study include claudication or pain while walking, resting leg pain, ulcerations, gangrene, trauma to the lower extremities, lower extremity embolism or thrombosis. The PADnet device enables earlier disease detection by performing pulse volume recording measurements, or PVRs, and segmental blood pressures used to calculate the ankle brachial index, or ABI, the toe brachial index, or TBI, and the segmental brachial index, or SBI. The ankle brachial index is determined by dividing the ankle systolic pressure by the arm systolic pressure. The normal ABI range is 1.0 to 1.4. An ABI of less than 1.0 can indicate narrowing or blockage of the arteries in the legs, increasing the risk of circulatory problems, and possibly causing heart disease or stroke. Pulse volume recordings are images that evaluate the blood flow through the extremity. A normal PVR waveform is characterized by a steep upslope, a narrow peak at the top, and the presence of a dichotic notch in the downslope. The following codes can be used for billing your PADnet study. The first code is 93922. When conducted at the ankle, this physiologic study has 2 components: ABI values and the waveforms from the ankle, including the PT or DP arteries. This code generally reimburses around $100. CPT code 93923 consists of the ABI values and the waveforms at 3 or more levels. This CPT code generally reimburses around $125. CPT code 93924 can be billed if you perform the study at rest and again post-exercise. And this study generally reimburses around $150. Next, we are going to look at identifying patients with chronic venous insufficiency, or CVI. Chronic venous insufficiency is a disease that is progressive in nature. It is caused by damaged valves in the veins or venous blockage. More than half of all venous ulcers require prolonged therapy lasting more than 1 year. Chronic venous insufficiency can lead to a more serious condition if left untreated. Over 30 million Americans are affected by chronic venous insufficiency, and out of those 30 million, only 1.9 will seek treatment. 40% of women will be affected by vein problems by the time they are 50. Without treatment, those with CVI may experience progressive symptoms that can be debilitating and significantly impact quality of life. In fact, more people lose work over vein disorders than from artery disease. Without treatment, chronic venous insufficiency can lead to leg pain, fatigue and heaviness, pigmentation changes, varicose veins, swelling, cellulitis, and ulcers. Risk factors for chronic venous insufficiency include a family history of CVI or deep vein thrombosis, increasing age over 30, vocations that involve long periods of sitting, standing, or heavy lifting, female gender, multiple pregnancies, prior blood clots in the superficial or deep veins, obesity or a sedentary lifestyle, high blood pressure and limited physical activity. Indications for CVI studies include varicose veins with ulcer, varicose veins with inflammation or infection, varicose veins with swelling, pain, and or edema. Venous refill testing in PADnet is a very simple test, normally taking around 5 to 10 minutes. Additionally, this test allows patients with edema to be tested with increased accuracy. You will have your patient perform a series of dorsiflexions with their foot in order to empty their vein. Refill time is determined on screen while the patient rests. $93965 is the CPT code used to bill venous testing. Marketing materials in your waiting area are a great educational resource for your patients. We have trifold brochures that explain both peripheral arterial disease and chronic venous insufficiency. They also explain test prep and what a patient can expect during the procedure. The patient questionnaires are a great tool for determining risk factors and indications for PAD and CVI studies. These questionnaires can be handed to the patients after they are brought back to their exam room and are waiting for the doctor. The questionnaires help tell the patient's story, and they often yield information that he or she may not tell you directly. The questionnaire also gives you the opportunity to ask your patient some probing questions. Do they have leg pain after walking? Do they have pain while resting? Do they have a previous history of blockages? Do they have a history of smoking or hypertension or high cholesterol? In addition to questioning your patient, there are also visual cues that you can look for. The patient's skin may be cool, dry, and atrophic. They may have skin discoloration or edema. Hair loss or uneven distribution on the legs is a visual sign of PAD. Muscle weakness, ulcers, and gangrene are also signs that disease may be present. Patients with chronic venous insufficiency can present with varicose veins or reddish-brown discoloration of the lower extremities. Using your ring finger behind the patient's calf is also helpful to palpate varicose veins that you may not be able to see. Diminished or absent pedal pulses can also be a risk factor for PAD. Start by removing the patient's shoes and socks. You can check for either the dorsalis pedis pulse, which is located on the top of the foot, or the posterior tibial pulse, which is located behind the ankle bone. Hold 2 fingers lightly against the skin. Move up from the toes toward the leg until you locate the pulse. Early detection and intervention leads to better patient outcomes. It can prevent cardiovascular complications such as heart attack or stroke. Because atherosclerosis is a systemic process, significant overlap exists between peripheral arterial disease and other forms of cardiovascular disease, namely cerebrovascular disease and coronary artery disease. Coronary artery disease is present in about 90% of people with severe PAD. Monitoring and treating your patients can help prevent progressive loss of leg function or even amputation. The prognosis following amputation is poor. 2 years following a below-knee amputation, 30% of patients are dead, 15 have an above-knee amputation, 15% have a contralateral amputation, and only 40% have full mobility. These are terrifying statistics, proving that early intervention and treatment is essential. Your EMR is a powerful tool for generating lists of in-need patients. Reports can be generated based on diagnosis, such as diabetes, arterial sclerosis, trauma, or vein conditions. You can also generate reports, patient lists, or queries based on certain risk factors, such as smoking or high blood pressure. If we can be of assistance in this area, please do not hesitate to let us know. So let's start thinking about our next steps. Do you have enough brochures? Are they easily visible for your patients in your waiting room? Do you need to print more questionnaires? We do have both peripheral arterial disease and chronic venous insufficiency questionnaires attached here to your webinar today. You can access those on your GotToWebinar panel. There is an area for handouts that you can maximize, and you can download those copies right into your system and print them out at your convenience. Let's also consider your questionnaire procedure. Who is responsible for handing them to your patients? The front desk staff or the medical assistant? Ensuring you have a process in place will be a tremendous benefit in making sure that all of your patients are filling out the questionnaire. Lastly, let's not forget about your EMR, one of your most powerful resources supplying a list of patients with risk factors and indications for a PADnet study. We would be willing to send you a list of ICD-10 codes that you can plug into your EMR to produce such queries. Thank you very much for your time this afternoon. We look forward to providing additional continuing education courses. As always, please let us know if we can help you in any way.